Dr. Sunday Udo, the national coordinator, the Leprosy Mission Nigeria, a non-governmental organization, has urged urgent action by government to end infection of the disease in the country. Udo, at a road walk to commemorate the 2022 World Leprosy Day, celebrated on January 30, reminded the government, as well as society, of the existence and threat of the disease to public health if not adequately handled.
Today is World Leprosy Day. It's a significant day in the annals of what we do. We want to bring to the consciousness of people that leprosy is still a big problem in this country, and we all have a role to play. The theme for this year is United for Dignity and Don't Forget Leprosy, and that is because we see a lot of attention being paid to other diseases, and then leprosy sort of is being neglected, and we are saying don't forget leprosy. It is still a big problem. It is still a significant public health problem in this country. In fact, every day 5 persons are diagnosed with leprosy in Nigeria, and that means we all need to come on board to support the work of the national program, the partners like TLM in Nigeria, ILEP, to make sure we defeat leprosy. A major challenge we've noticed in leprosy is the stigma and discrimination. That is really sad because leprosy is curable, and it doesn't take more than 6 to 12 months to get that cure. So I sometimes wonder why people still have that fear for the disease. It is not contagious. It is mildly infectious. It doesn't jump like COVID. It doesn't jump like the common flu. So it's not something we should be afraid of. It is curable, and treatment is free. That's why we're making awareness today that if you know you have any skin patch on you, it is a bit lighter than your normal skin color, it could be leprosy. Come out to the nearest health center and get tested and get treated.
Dr. Walter Mulombo, World Health Organization representative in Nigeria, represented by Mr. Suleiman Aliyu, neglected tropical disease focal point of the organization, commended the organization for their awareness work, which he says would help the world body in its fight to eliminate the disease.
This work is completely important for Nigeria and for the NTD community, especially leprosy, because we are raising awareness among the populace and the masses to understand the importance of leprosy prevention, control, and that we are aiming towards elimination. It's a neglected tropical disease, therefore most people really don't know about it or think that it doesn't exist anymore. So we actually want to let people understand that yes, let them understand the signs and symptoms of leprosy, where to go, and then how to actually get it managed. It is completely treatable and curable, and then if you prevent it early, then you won't have the disabilities that come with leprosy. WHO also provides the medicine needed for the treatment and management of leprosy. Of course, not only leprosy, but many other neglected tropical diseases as well. So yearly, we ship in these drugs, quantity of drugs for these patients, free of charge.
Mr. Debayo Peters, the leprosy focal person, National Tuberculosis, Leprosy and Burulai Ulcer Control Program, said Nigeria was working vigorously to meet the WHO target of zero leprosy in children.
For the fact that children are coming down with leprosy, which is against the WHO recommendation of zero leprosy in children. But right now in Nigeria, we still have close to children who are reported, close to about 6% of leprosy cases in Nigeria are children. And people still come down with disability. We have disability of close to 50% in the country, which shows that cases are reported late. So the essence of the awareness is to make people know that yes, there is still leprosy very much with us, and that people should not hide when they see patches on their body. They should always come out and they will be diagnosed, and when the diagnosis is done, the treatment is free.
The Nigeria Center for Disease Control says over 3,500 people get infected with the disease every year in Nigeria, and about 25% of them go on to develop physical disabilities.